Somalia's health ministry has confirmed 34 new cases of COVID-19 in the last 24 hours, bringing the total tally of infections to 1,455. Fawzia Bikar, the health minister of Somalia, said one more patient succumbed to the disease, bringing the total number of fatalities to 57. She said 11 people recovered from COVID-19, bringing the total number of people who had been discharged from hospital to 163. The minister also noted that 21 of the latest cases were male, while 13 others were female, and the cases are largely due to community transmission. She has called for unity among people in order to successfully control the spread of the disease, saying the government has put measures in place to contain the spread of the pandemic. The Horn of African nation has instituted measures to contain the possible spread of COVID-19, including closing schools, banning large gatherings, and suspending international as well as domestic passenger flight. UN agencies and partners have scaled up responses to the pandemic, targeting 6 million people every week through intensified risk communication and community engagement, assisting the federal government and member states to detect, prevent, and interrupt the transmission of the disease, and supporting access to essential healthcare services across the country. 3 laboratories capable of detecting COVID-19 are now functional at Mogadishu, Garowe, and in Somaliland, Hargeisa, and 1,238 samples have been tested across the country. Meanwhile, the Somalia's Humanitarian Fund (SHF) has allocated 400,000 to expand treatment facilities at Martini Hospital in Mogadishu, bringing to 2.57 million the total SHF contribution so far to COVID-19 response in Somalia. Allied with government efforts, UN agencies and partners launched the Somali Country Preparedness and Response Plan on April 23rd, seeking $232 million out of the $689 million to bolster preparedness and response to the public health as well as humanitarian consequences of COVID-19.